I would like to invite Professor P.F. Kotur, Professor of Anesthesiology and Dean, Arapade Vidu Medical College, to chair this session.
I think Dr. Kotur sir, we can avoid introduction. I think we already had it once.
Yeah.
Yes, sure.
I will not avoid and do justice.
You can just skip it.
It took 75 years for the medical educators in India to cross over, overrule or redefine or the medical education in the country, and which is a Herculean task that was done by Dr. Avinash Supe with a team, which is a vibrant team. And already Professor Sethuraman said, the next one, PBME, performance-based education.
I already noted that, sir.
Yeah. And we are indeed fortunate to have you here,
sure.
Sir.
Thank you so much.
Over to you, Professor Supe.
Sure. Thank you so much. And I think it's wonderful to listen to Dr. Sethuraman anyway. I think Dr. Mahalakshmi told me to talk on these specific topics. So I'm going to speak on these specific topics of creativity, critical thinking, innovation, and entrepreneurship. And how do we foster this among our students of health professional educations? Is it working? Okay. I would like to really thank iCON 2022 team, my friends from Mumbai, YouTube, and one of my close friend, Arpana Hegde, and I have no conflict of interest to declare. I think if you ask why these people are successful, Apple, Mahatma Gandhi and freedom, and Wright brothers and aeroplane, I think all of us, they have their own way of thinking. They never thought in a normal way. In fact, I don't know how many of you seen Steve Jobs in 2007 when he launched the whole iPhone. This was a complete disruptive kind of an innovation. All of us have gone through this talk, and I feel I was amazed with the way he completely changed the world with a kind of a mobile. All of us used to struggle with keyboards in our phone, and he changed it and brought this new concept. So if you really look, usually there is a what, there is a how of a particular process. But if you want to really think, you need to do why. And why is because they thought differently. They thought something which was not the routine thing. And that's the reason they were successful. Look at why Apple today is the highest being sold. Many people are passionate about. Having said that, we have to learn today that we are dealing with uncertainties. What do you mean by uncertainties? Medicine and medical education will change in next few years. All of us have seen the change, and today's students are going to see much more change. Do you know what to teach our students when we don't know what is going to be the change? Now that's the problem with all of us. We feel my curriculum, my subject I am teaching is perfect, but it is not so. Are we preparing them for future? So we have to think about newer material, newer technology, newer evidences, and changing mindsets of patients. To give you an example, 25 years ago, sending money from one account to another was a task where I had to go to my home, take out a checkbook, write a check, give it to that person by post, he will collect it, then he will write a slip, he will go to the bank, somebody will put a stamp, then there's a runner who goes to there where there's some kind of thing was done, then it will come to my bank. After 3 days, the account gets with that money. Today, there were so many people in a chain. Today, my money gets accounted in about 5 minutes, 3 minutes, 2 minutes. What happened to those jobs today? All those jobs are lost. There are no more now in a bank. Everything is online. If you look, what is happening? Okay. The risk of job, just go back. Either I will do it or you do it, okay? Fine, sure. The risk of job being replaced by automation is, if you look at this, this is a scientific report from the Technology at Work and Professor Mashelkar, that we have risk of jobs being replaced at so many percentages. Think about, we are trying to put so much of effort on our children, our students, but we don't know what they will be after a few years. So this is our risk. So, having said that, therefore, what is today relevant is to teach them top critical skills, complex problem solving skills, critical thinking, creativity, all this emotional intelligence, because these are the skills which will remain with them for lifelong. They are not going to go away, and they will be able to cope up with any new technology. So if you talk about education 3, education memorization and brute force recall is made irrelevant. I think Professor Sethuraman talked about education 3. Problem solving, curiosity and innovation are the key. So students are transformed from passive to active, completing to creating, and all these changes are coming up. I think we talked about autonomy, we talked about asking. Teachers are transforming, student-centered, listening, multiple streams, facilitator, process experts. We are also changing. But if you really see, these are the 4 new tools which Mahalakshmi has asked me to speak on. And I'm going to really restrict them to critical thinking, creativity, innovations, and entrepreneurship. Now let's see what is critical thinking. If you really see critical thinking refers to the ability to evaluate information and to be aware of biases and assumptions, including your own. Look back at your own thinking. Look back whether you are learning. Like an information literacy, it involves arguments, identifying, solving problems, objective and systematic way. Very nicely said, critical thinking means making reasoned judgments. All of us do it every day in our clinical practice. We reason out why this particular patient has a liver palpable, spleen palpable, whatever you are doing. So what is analytical thinking? You know, we have to think about analytical thinking. All of us are now fond of OTT, and we have been seeing on iPads every day, at least for an hour. Now I would like you to see this video. So go back. Just press that. Sherlock Holmes.
We're obviously looking at a suicide.
It does seem the only explanation of all the facts. Well, it's one possible explanation of some of the facts. You've got a solution that you like, but you're choosing to ignore anything you see that doesn't comply with it.
Right.
It moves on the right side of his head. Cancun is left-handed. Has quite a bit of contortion.
Left-handed?
And the nose didn't notice. All you have to do is look around this flat. Coffee table on the left-hand side, coffee mug handle pointing to the left. Power sockets habitually use the ones on the left. Pen and paper on the left-hand side of the phone because he picked it up with his right and took down messages with his left. You want me to go on? No, I think you've covered it. I might as well. I'm almost at the bottom of the list. There's a knife on the breadboard with butter on the right side of the blade. Because he used it with his left, it's highly unlikely that a left-handed man would shoot himself in the right side of his head. Conclusion, someone broke in here and murdered him. Only explanation of all the facts. But the gun, he was waiting for the killer. He's threatened.
How many of us, we enter the room, can find out the person was left-handed or right-handed? This is observation. This is analytical skills. When we see a movie of Sherlock Holmes, I'm always amazed with the way he analytically thinks. Maybe it's a movie, but if you really go back and find out, you know, in a child, I was always given these kind of puzzles. There are 4 prisoners who are standing like this. They have a black hat and white hat, and judge tells them, don't move, but tell us which is the person hat you are wearing without looking at it. And is by analysis, he tells me that the number 2 will say that this is my hat, because number 1 has not made noise, number 3 cannot make noise, number 4 cannot make noise. Only 2 can say that there is a backpack in front of me and 1 number has not made a noise, so my hat is white. This is typical analysis. So you need to think analytically and you need to think analytically. So can you please reflect on how did we think about this puzzle? So if you see, so critical thinking and clinical medicine is always that critical thinking for a physician helps him to make right clinical decisions and provide best care in the patient care process. Now, Medical Students Guide for Critical Thinking. Very nice booklet came out somewhere in August 18, 2021. I would like you to read this booklet. And this booklet was a recent booklet which came. And if you see, there are 6 steps of critical thinking, they said. Determine the issue of the question. Gather relevant information from all reputable sources. Analyze. Be careful about confirmation bias. Most of us are confirmation bias. If I think this is malaria, I will say it's malaria. Don't be like that way. Synthesize information and then make a logical and well-reasoned conclusion. So, I'm sure this was an article from Jipmer, Jaya Prasad and Gitanjali, and they said there are so many benefits of critical thinking. If you really look, there were so many medical or clinical benefits which you can think about clinical thinking. So you bring out to the world of critical thinking from a clinical reasoning, ability to sort out cluster of features presented by patient and accurately assign a diagnostic label, ability to integrate and apply different types of knowledge. And it's a complex cognitive process.
Joseph Bell was an extraordinary teacher by all accounts. And Conan Doyle, writing about Bell, described the following exchange between Bell and his students. So picture Bell sitting in the outpatient department, students all around him, patients signing up in the emergency room and being registered and being brought in. And a woman comes in with a child, and Conan Doyle describes the following exchange. The woman says, "Good morning." Bell says, "What sort of crossing did you have on the ferry from Burnt Island?" She says, "It was good." And he says, "What did you do with the other child?" She says, "I left him with my sister at Leith." And he says, "And did you take the shortcut down Inverleith Road to get here to the infirmary?" She says, "I did." And he says, "Would you still be working at the linoleum factory?" And she says, "I am." And Bell then goes on to explain to the students. He says, "You see, when she said good morning, I picked up her Fife accent, and the nearest ferry crossing from Fife is from Burnt Island, and so she must have taken the ferry over. You notice that the coat she's carrying is too small for the child who was with her, and therefore she started out the journey with 2 children, but dropped one off along the way. You notice the clay on the soles of her feet. Such red clay is not found within 100 miles of Edinburgh, except in the botanical gardens, and therefore she took a shortcut down Inverleith Road to arrive here. And finally, she has a dermatitis on the fingers of her right hand, a dermatitis that is unique to the linoleum factory workers in Burnt Island." And when Bell actually strips the patient and begins to examine the
I think all of us as clinicians must teach our students not only to look at 10 causes of cardiac failure or 10 causes of liver failure. We must also look at them holistically, understand, clinically analyze, social, everything, all aspects. And this was a classic example that how patient walks in, how your mind should analytically thinking. And that will make you think more clinical reasoning. So there's a process of clinical reasoning. You have a cue acquisition, hypothesis generation, cue interpretation, and hypothesis evaluation to come to a conclusion. So all of us continue to make cognitive shortcuts. You know, I always feel we make mental shortcuts. In OPD, when you're seeing 200 patients, I have a formula which I try to see, okay, this patient like this, I have a mental shortcut. So we have a confirmation bias. We have to come out of all that at times, and we have to think every patient's every word. We need to be alert and try to think critically. The question is, how do we teach our clinical reasoning to our students? Now, if you really see there are different methods of doing it, you can brainstorm, like Professor Sethuraman said, you could try to bring clinical problem solving together. Mind mapping is another big thing people can think about it. Lateral thinking, trial thinking, reflections, and debriefing. These are the ways today we need to bring in analytical thinking in the minds of students. A boat has a ladder that's 10 feet long and hangs on the side of the boat, at least 3 feet submerged in water. If the ocean tide rises 5 feet, how much of the ladder will be underwater? Very simple question which was asked. I think there's still 3 feet, because the tide rises, the boat will also rise. Now, these are all lateral thinking questions. All of us have to understand that we have to make our students go to lateral thinking. And having said that, there are a lot of educational strategies in the literature to tell you, basically to encourage students to state possible hypotheses, prioritize differential diagnosis, compare and contrast various differential diagnoses, link clinical knowledge to basic sciences, which we have been doing through integration, early clinical exposure, formative feedback and deliberate practice, metacognitive processes, these are currently being talked in a big way, and increase confidence in dealing diverse situations. So in fact, if you know, there are many models today. 1 minute preceptor model is very commonly used today on the rounds, which will tell you, diagnose a patient, diagnose a learner, and then teach positive feedback, correct errors, and teach general rules. I think this was brought by a family physician, but today it is very commonly used by all the clinicians for use. And if you really look at the percepting micro skills, how a teacher can really get, and the SNAPS model, which was brought by one of my friend, Walpole, who really got this new model of summarizing, narrowing, analyzing, probing. So probing is very important. You would like to bring analytical skills by probing. You know, something like even your own child, don't give it everything to him. Make him reflect, analyze, and then give him something. Many times parents have give everything to him at the beginning. Don't do that. Try to develop analytical skills, critical thinking skills from the childhood. So there are a lot of examples of application of critical thinking in medicine, and I won't really go into details, but at every stage you will find we need to have an analytical or critical thinking skills, which is today very important. Let's go to the new tool, which is creativity. And creativity has been always the word which is used. Creativity can be defined as ability of power to create or to produce something useful has not been previously existed. So, if you really see, it's a powerful imagination, ability to think up, designing new world. But I think there are different kinds of creativity. Now, deliberate and cognitive creativity, that is planning and expertise, creativity with a purpose. There could be spontaneous or cognitive creativity, like eureka moment, that you're doing something and you suddenly got something. There could be emotional and deliberate, where the logic meets emotion. And spontaneous and emotional, sometimes you are unexpected and it really comes to you. So there are a lot of differences between creativity and innovation. And I think creativity requires inspiration, cognitive, potential, while innovation is usually tangible. Having said that, there was a very nice framework I really learned, that if it is, what is a novelty versus usefulness? All of us want to bring something new, but we should also think whether it is useful. If it is novelty, but it is not useful, it's interesting. We will always say, it's interesting, let us see. If it is neither novel, neither useful, it's always boring. It's routine, I must tell you. If it is useful and not novel, then again it becomes routine. But creative is something which is novel as well as useful. So when you use the word creative, it means it is going from not novel and not to the usefulness. And if you are able to take it to the creative version, that is something which is important. So creativity is not an art, but it is all about capacity of creative thinking. It is originality to produce outcomes and values. Now in India, you know, we have to many times think about creativity because there are many things are not available to us what is available in the West. So we need to adopt it. We need to always make innovations and we try to use it in clinical setting. So how to learn settings, how learning settings influence creativity. This is always important. Supportive environment. Today I think Dr. Kotur talked so well on environment. Interactions, reactions, warmth, encouragement, positive democratic environment. Creative programs, creative teachers and way of thinking. In fact, we have to promote creativity through compassionate and accepting environment. Be present with students' ideas. Reword assignments to promote creativity. You know, you use words like create, design, invent, imagine. Students will be probably much more acceptable rather than write down, just write an essay. Give students direct feedback on their creativity and creative instructional strategies and models and method you can do. I'm sure all of you seen this movie.
ऐसा स्कूल तो सारा रैंचो ही बना सकते हैं।
पर वो है कहाँ?
I'm sure ऐसा school rancho ही बना सकता है. The word is so important. If somebody has decided to make a school like this, where students enjoy, they are creative, they are useful, and they are. So look at that movie was so amazing for education. It tried to bring new concepts into the life. So look at this Cambridge International Examination. You have innovation and creativity. You have creative learner. You have creative teachers. Creativity in classrooms, assessing. So what you need to do is creating the culture. So why creativity is important in medicine? Medicine brings the objective research of science and creative aspects of art because it uses a lot of factual studies as well as innovation in imagination. So in fact, Bloom's taxonomy is revised now. It begins with remember, understand, apply, analyze, evaluate, and create. So what Sir talked about low order thinking skills to high order thinking skills. Lots to hearts. Now, when you are trying to take your students from, say, remember to create. Now, for example, look at this AWR surgery, which is abdominal wall replacement. You know, I mean, this is something which is being now a new world which has come out with this. So, remember is anatomy, understand is pathophysiology, apply is knowledge, analyze is diagnostic value of imaging, evaluate is alternative hernia treatment, and create is a new approach for hernia repair. So, we have now a new world of AWR which is coming up. And you know, this is where I personally feel we need to bring medicine into this level. The third tool is innovations. I'm sure innovations have been part of life of ours. Many times we do it because we have shortage of resources. Now, so being innovator is hard. Sometimes you learn by trial and error. All of us try something, we fail, as you rightly said. Sometimes people focus on failures rather than successes. Sometimes you can't find like-minded individuals. And sometimes people are afraid of you because you want to do things differently, but it's always seen that way. You know, look at examples in the world. If you look at history of surgery, laparoscopic surgery by Eric Muhe was introduced somewhere in 1986. He was ridiculed in the conference. He was saying galloscopy, he said, gallbladderscopy. And people laughed at him. In fact, there was one complication, he was jailed in Germany. And later on, he was given some kind of he was given an award after 1992 when the world started doing laparoscopic surgery. When in my own institution, I did my first laparoscopic appendicectomy somewhere in 1990. And when I did it, it took about 4.5 hours. You know, one of the lecturer wrote a letter to the dean that Dr. Mathur and Dr. Supe are doing unethical things because they are taking 4 hours to do appendicectomy. We have to face sometimes trying to innovate. And today, after 35 years, you find laparoscopic surgery is part and parcel of everybody's life. So when you're trying to become innovator, sometimes you face a lot. And I think you will find, okay. Now I'm going to give you some examples, how people think. Innovation slates. Look at 1703, Teachers' Conference. Students today can't prepare bar to calculate their problems. They depend on their slates which are more expensive. What will they do if the slate is dropped and it breaks? They will be unable to write. This is Students' Conference. Okay, now you will laugh at it. Fountain pens. This is PTA Gazette, Parent Teachers Association Gazette in 1914. Students today depend on their expensive fountain pens. They can no longer write with a straight pen and nib. We parents must not allow them to wallow such luxury to the detriment of learning how to cope up in a real business world which is not so extravagant. Now, will you really accept this today? Students, did I read this? Okay. This was students today depend on a store-bought ink. They don't know how to make their own. When they run out of ink, they will be unable to write words. This is a sad commentary on the modern education. Ball pens when came, federal teachers in 1950. Ball pens will be ruining the education in our country. Students use these devices and they throw them away. The American values of thrift and frugality have been discarded. Businesses and banks will never allow such expensive luxuries. Today I'm fine, my own child or my grandchild will take a pen and throw within a half an hour and take another pen. And this is what is routine. All of us have gone through this. Computers, there is no reason anyone would want a computer in their home in 1977. Even Bill Gates said 640K ought to be enough for anybody. Now everybody wants today 256 GB, 16 GB RAM, and we look for every specification before we buy our mobile, which is as good as a computer. And I'm sure when mobile came first, everybody had the same reaction. Who is going to pay for 16 rupees per minute and 8 rupees for receiving call? All of us went through such a pain. All of us, I'm sure all of sitting here have always gone through all this nonsense. But today, if somebody keeps away your mobile for half an hour, you feel little uncomfortable. Kya ho gaya mujhe? So there are 4 types of innovation: incremental, architectural, radical, and disruptive. And there is a way of really looking at these innovations in a different way. We should always look for the disruptive innovation. Like what Steve Jobs done in 2007 was a disruptive innovation. We all were struggling with mobile phones, with flaps and query keys and all that. He brought the whole concept of music. What happened to those music iPods? They just disappeared. We are all on mobile today. Videos, we are all on videos on mobile. We have to do everything on mobile today. So it has a disruptive innovation technology which has come. So some of the technologies could be incremental, where they enhance. Some of them could be architectural. You change the way it is there. Some could be very radical surgical changes, something like that. Peptic ulcer surgery. When I was a student at that time, every day we had one vagotomy pyeloplasty, one gastrojejunostomy. Today, ranitidine came, omeprazole came, rabiprazole came. Where are those operations? They are not needed. They are lost. Students have lost that art. Teachers have lost that art. That means what? Overall, the things are changing so fast. And I think we all need to be part of this understanding of this innovation. I must tell you about this M Mitra. Very wonderful experiment where I was part of this. See, I became dean in somewhere in 2013, and I went to the Sion Hospital. So this young lady came to me, Aparna. She was a student of Sion Hospital, and she's seen mothers dying. So she said, "Sir, I want to do something for mothers." They said, "What do you want to do?" So she says, "I have an AI-based virtual guidance." I said, "What do you mean by this?" She says that we will have a kind of a machine which will call every mother, will register her, and every 15 days from her conception to 1 year of child, we will give her AI guidance, and every month we will have some kind of and talk with her, direct talk. So I said, wonderful idea. It started with one college. Sion Hospital has a huge OPD. I don't know how many of you really know, but Sion Hospital, like my daughter was a resident there, and Saturday, Sunday, she used to have 150 deliveries and 40 cesarean sections. That kind of a workload she has. So huge number of patients. And in that particular way, we introduced this M Mitra, and the program took off. This was about few years ago. Today, you will find, can you go to the next slide? Okay. Today, this program is such a successful program. There are so many new programs have come. It is in 2.6 million women have been reached. 9 states, so many NGO partners, 97 hospitals across India. It is going now outside India. They have got so many awards. Now you will find a simple AI-based virtual guidance to a mother will definitely. Now, does it really make a sense and impact? Now, there are enough papers would say that assessing impact on mobile-based intervention to the health literacy among pregnant women in urban India, in rural India. So now we are trying to look at the impact on the maternal mortality and all this. So you must really try to think about a kind of an innovation and look at its impact on nutrition of women, iron intake in pregnancy, importance of lactation and colostrum, better immunization compliance. And one of the patients who came and told me very nicely, she said, "Thank you, doctor. Because of this program, my family has started respecting me and they have given me mobile." This was a slum lady. Now look at the empowerment they get through a simple innovation, and that is the kind of way you can do in your own system. It doesn't require much of thing, and actually it was just a mobile, the donations and allowed this. The program has gone so rapidly. So simple innovations like this can make a change into healthcare, and our students must really know about this. I don't know, many of you don't know, but ICMR has a medical innovation fund, and they gave money. Universities have innovation fund, but they are hardly used. Nobody knows, nobody applies, and nobody wants to utilize and put heart into this. Electronic stetho in India has now become economical. We used to have a costly kind of a stetho and now Littmann, but now Indian people have done that. Simple devices like how to collect blood, how to locate a vein, all these are becoming now electronically wearables where people have been using it, and these innovations are helping many of these students to learn. So scientific innovations continually provide us with new means of analyzing the finds. And that is something which all of us should really think. There are so many articles on medical innovations, like innovations in pharma. In teaching, you can do so many innovations. You can think about cardiovascular drug fund cricket, you can do medical education innovation challenges, you can have students' perception on creative study guides in pharmacology, Kurukshetra model, charismatic kind of thing. You know, so many things people have really done to teach and do innovations while teaching. So it not only makes children happy, students happy, but also the teachers are also engaged and happy. So it's a different world which you are looking into. Let's go to the last tool, that is entrepreneurship. Now this is a little difficult one to do. It's not so easy to become an entrepreneurship. Most of us are happy when you get a monthly pay in our first of our month, and we feel happy about it. But when you become entrepreneurship, you know, you have to go something like little more risk yourself. So why expose students to technology and innovations? Exposing medical students to technology will help ignite and implement innovative ideas from young minds for betterment of patient care. And transforming feasible ideas into reality for patient care after requisite approvals from various regulatory agencies is the ultimate goal for their endeavor. Ultimately, we want to see the product to come to the market. Now, if you see, carving a niche in an untapped market or even maintain standards in a competitive market through a continuous search. So successful medical entrepreneurs are those who understand the market needs and can connect better with customers by filling a necessary gap in available health services. So all of us probably can know where is the gap. If I am a practicing clinician, I know what is the need. See, somebody might come and do it, but if I'm inside, I know. You know, when I was somewhere in 1989, I wanted to learn ERCPs. So I went to Germany and started doing ERCPs in 83, but 89 I want to refine it to do sphincterotomy. That was a new world. So I went to Professor Sohendra in Germany. And when I went to Professor, there was Wilson Cook, the whole company, you know, is a big company who creates these sphincterotomies. So Don Wilson was with me for 1 month. He used to discuss with everything, and then he devised all those sphincterotomes, and then the new world of sphincterotomy came. But why can't a doctor do it? Why a company person has to do it? A doctor also can put enough effort and do this. And he will probably know better that what kind of sphincterotomes I want, what kind of endoscopes I want, what are my problems when I'm doing in patients. If I'm able to do this with technology, I'll be able to do better. And therefore I feel there was a lab which was opened in JJ Hospital, which is next to my hospital. These are our students, but now they are big consultants and gynecologists. They start this MICE lab, Medical Innovations, Creativity and Entrepreneurship Lab. You know, it's called as a MICE lab. Perfect, I don't know, probably from where only Mahalakshmi has taken this topic. So Grant Medical College, and this is a lab which they have, and they probably have all these kind of electronic components, they have sensor kits, humanoid, they have 3D printers, and they continue to do. I think they could do much better. But I personally feel at least they have begun to make students think in a little different way. They give projects to the students. Another program which I was involved with, what is called as a BETIC program. Very interesting program. This was a program of medical device innovation program with IIT Mumbai. Now today, the global trend is to break the walls between engineering and medicine. We were all talking about integration, anatomy in physiology and biochemistry, and we had a lot of tough time to do that. But now I think people are breaking walls between medicine and engineering, medicine and art, medicine and commerce. I think people have been trying to look at it because ultimately health is a holistic issue. It is not going to be only technical. So this BETIC program was a very interesting program in IIT. So they thought that medical devices are not so easily found. So about 10 years ago, these people started, and that was a Biomedical Engineering Technology Innovation Center. There was a Professor Ravi, very interesting person, he's a professor in IIT, and he started this BETIC program, one word from each, one letter from each of this word. And he created this kind of a funnel from different aspects. Ultimately, he tried to see that we should try to bring an idea to impact innovation ecosystem. And what he really did was, he tried to develop an innovation culture, team structure and critical infrastructure. He took people from our hospitals, lecturers, professors, and there used to be monthly teams like orthopedic surgeons, and everybody wanted, I wanted a particular kind of an retractor, which I was not getting. So he tried to create that. Somebody wanted a leg. So he created all that. So engineering and medical people worked together and they created wonderful kind of innovations in this particular world. And you find it, BETIC program today has so many outcomes. Like say they have patient-specific leg prosthesis, patients touch, then these patients can run, they can walk, they have so many other areas. You can have digital stethoscope, digital ophthalmology, glaucoma screening, diabetic foot screening, so many medical innovations, and they yearly now conduct a conference where people have been doing. My own lecturers has devised so many instruments and many of them now going towards patent. So I personally feel this is one aspect in medical practice which we are not doing very well. We need to tap more, we need to create, think what we really need, and we need to do that. And I'm sure over a period of time, what you need to have conceptualize, then you need to have a virtual prototyping, then plastic prototyping, and then electronics prototyping. And I think people are going towards this. And this is something which I was very impressed in many foreign universities. In fact, one of the advantage of having a medical person doing all this entrepreneurship, because he's socially responsible. Because one of the major moral dilemmas faced by medical entrepreneurs is the need for establish a profitable business while maintaining the social responsibility to the general public. Any medical professional is not going to make a lot of profit. He understands that if I'm going to make it for poor patient, I'm going to be socially responsible. And that's a great advantage all of us should have. And I think therefore we should promote our students going into this. So they came as a design thinking and innovation. Design thinking and innovation. So I think Sethuraman sir only talked about this design thinking concept. Now design thinking and innovation is coming in a big way. It's a process of creative problem solving. That means you empathize, you define, ideate, prototype, test and implement. Now this is becoming one of the key factors in last few years. In fact, if you look at design thinking in a healthcare, patient needs, healthcare business ecosystem and healthcare technology. All three come together. And you will find they will try to, previously we used to do simple thing like define the research objectives, make a research plan, conduct research. Now we generate ideas, prototype it and validate concept. And then you reflect it on workflow and micro interactions. So this is something which is becoming very popular. If you have, so this is a wonderful model they created, top-down approach, then bottom-up approach, health tech innovation design, demand for innovation education, and this is the way they would probably bring curriculum for the health innovation. Since this is an innovation conference, I thought this is something which all of us should really understand. In fact, this is wonderful CDC, and this is something quite recent, recently 2018, they brought this preventing chronic disease, they brought design thinking in healthcare. Wonderful booklet. I think all of you should really read about this booklet. And they brought out this particular formula of need finding, empathize and define, then ideation, testing and prototyping, and then implementing, and you go through that cycle. So I think if you start thinking towards problem solving, my tomorrow's student, even if he doesn't know 10 new causes of the new viruses, he will learn on his own, he will create ideas, he will create prototypes, and he will implement. What is important is to make him understand the process learning rather than making him a robot answering and ticking MCP questions. So look at these universities, European universities, they are already one step ahead of us. They have a medtech school. I was teaching students from this university on some topic and they told me, sir, we already have this 6-year course where there's a 6-degree course in medicine and biomedical engineering taught in English, MD and BTech at the end of 6 years. New experiment. I really don't know how it will happen. But it's already there. There are 60 students, 10 are Indian. They're already working and they will have an international license to practice everywhere after they pass from this university. Amazing work. Harvard, many universities have already started this. They're working on this. New way of thinking. IIT Kanpur, I don't know how many of you have really seen, School of Medicine and Engineering. And they have a Mehta Family Center for Engineering and Medicine. And now look at the kind of research focus they have. Digital medicine, molecular medicine, regenerative medicine. You should go and see their lab. Super kind of a lab. They should really see the way they are thinking. And we are still in that rut of 3 hours teaching. So look at the world, how it is changing. Virtual autopsy in India. I'm sure virtual autopsy was a concept which was not accepted today, and AIMS put it, and when Raju Srivastav died, they did virtual autopsy to make him diagnosis that he died because of heart attack. Now the whole idea is that this is now it was a UK model, now there's an Indian model to do a virtual autopsy with their own software. So people are innovating. People are trying to do this at their own centers. So how do we bring this in our curriculums? I have last 5 minutes, so I will try to end in that particular way. The whole question is, how do you bring it in our own curriculum? Now, paradox of medical training is it is possible for a medical trainee to be in possession of all amount of knowledge, but still not an effective physician. Many times he has all the skills, but he is not able to deliver those skills effectively to the patient. That's our paradox. As Sir said, it's competency versus performance. He may have competency, but he is not able to perform, or he does not perform because of the motivation. Whatever you say, we have this paradox in our life. So we always talk about right to education, but what is more important is right way of education. We need to bring back all this to our thing. So how to acquire wisdom? Sir said it very nicely. So you live, make mistakes, learn from your mistakes, repeat step 1 to 3 until wisdom is acquired. Realize that the wisdom you acquired in step 4 was not really the wisdom, so you repeat all the steps. So you go through that data, information, knowledge, wisdom to insight. All of us walk through this pathway. All of us go through this kind of a pathway, and I'm sure all of us would continue to make our students go through this pathway. So there was a very nice book I read. You should all read this, Positive Teaching. This is easily available on the Z library. Meeting mutual needs, changing counterproductive feelings, all about environment and how do you really make students about active learning strategies. So one of the experiments we did was medical humanities. This is a philosophies, art, humanities and social sciences as counterbalance to the relentless reductionism. And we introduced this about 7 years before in our college, and is a sustained interdisciplinary inquiry. So we tried to go beyond our regular medicine, and we conducted various workshops on resilience, film shows, working in slums, poetry in medicine, human library, narrative experiences, panel on corruptions. And we thought our students had a lot of impact, and students come back and they try to tell us the different kind of attitudes. I cannot really put it in here. So what are the challenges? This is additional curriculum in NEET era. Everybody say, where is the time? I don't have time. It's so tight. Dr. Supe, you have given us so curriculum where there is no space. Working after regular classes. Extra effort by teachers and students. As I said, teachers are one who are under stress, and funding is an issue. See, we believe in top-down approach in India. We want everybody to write a line in MCI. We want everybody, Government of India will direct to NCE, and MC will give it to university, university will give it to the dean, teachers and students. We want top-down approach. Everything you want black and white. Sometimes I only feel that people follow that line, what you have written so carefully. So I think we need to really think 10 times, how do we really go about this? So we are creating medical school or a factory. We are taking away individuality of a person. We are trying to create people of the same kind. And people are not like that. Doctors are not like that. The people are going from different sides and we want to create them at the same time. It doesn't happen. We want autonomy. We want people to be different. We want our individuality to be maintained at that time. So, sure, this is some difficult task. So, these are changing trends in medical education where competency-based education, experiential learning rather than didactic, all these are coming up in a big way. Digital and artificial intelligence has come in a big way. I did not talk too much, but I must tell you that today we work with HoloLens, today we work with Open Chat. I think yesterday he taught me Open AI, where I just put on hypertension MCQs and I get everything in hand. So I think things are better today for teacher also if you learn this technology, but embrace this technology with a lot of metaverse and digital health. What has happened, I think this is one word which I want you to remember. I'll take 1 or 2 minutes more with the permission of the chair. Now, if you find in 19th century, we used to do X-ray based screening, then we went on low density city, then we want a high density city. Now we are all talking about AI and VR, and in COVID times, all of us use AI for diagnosing COVID pneumonia and all those courses. So now we are going into metaverse and digital health. And I personally feel, so the change is changing. According to me, whatever we call as a change, it itself changes the next day. The knowledge is doubling every 73 days. The change itself is changing. It is essential as a faculty to learn new skills, self-assess, upskill, reskill ourselves and develop cross-skill competencies. This was a theme of this conference. So apt, I personally feel. And if you really see, you have the next slide? We the educators need to prepare with resilience, perseverance and future needed training. Pass through the threshold of conviction that continuous research and training in the area will make us, if not better educators, at least the best prepared ones. And we have to see that while giving them the knowledge bucket, we also give them lifelong skills like problem solving skills, critical thinking skills, analytical skills, and innovation and thing, so that when they walk without you, without when you are not there, they will be able to sustain themselves in future. So I personally feel this is the need of the hour and let's do it together. Thank you so much.
Your thought-provoking and convincing thoughts lecture, which will certainly give a lot of food of thought for every one of us. And I must tell you to 1 or 2 sentences which supplement your hypothesis or your thoughts what you have given. Change is changing, change is ever changing. Okay, and we did one humble study in 2007 and 8 in Belgaum. Early introduction of PBL or EBM, which enhances critical thinking. And we can measure critical thinking with the help of CCTDI, California Critical Thinking Indisposition. We measured in the newly admitted first MBBS students, early introduction of these paradigms, and we convincingly found out the various components of critical thinking like an open-mindedness, listening abilities, analytical skill, evaluation skill, decision-making skill. We found out a convincing evidence that critical thinking, if it is taught for the students in the early part of formative years, then it will refine the final product of, I hope you will refer that. I am sure there are many questions for Dr. Avinash from the audience. Yes, Sanjay is already in the hand, yes.
Sir, thank you for this excellent, mind-blowing presentation. I just want to introduce one word which I read just yesterday in the flight. I picked a book on the airport. It's called Shinkenism. Shinkenism is that there is an incremental innovation. You make an omelette and then you put some spices in it, some potatoes in it, and then you keep, so it becomes the Spanish omelette or this and, but there is something called, somebody first time he put an omelette, put an egg and then made an omelette. That is a radical. And you know, in Japan, the Shinkenism, the strain. Shinkansen. Yes, it started in year 1960. 200 kilometers in 1960. We are doing it in 2022.
We are still not able to do it.
I mean, whatever we are doing this Vande Bharat, etc. And the philosophy at that time, they thought absolute radical. Now, in your context, why Mitra is only 2 million people in a country of 130, I mean, so many, 130 crore people are there.
No, it is expanding, but there are a lot of, I mean, see, there are cost filters, there are, then people, I mean, if you see there are so many filters, people happen, but ideally it should go everywhere.
I mean, just one, Prime Minister Modi brought just one sentence at the top and there were toilets everywhere in Independence speech. So one sentence from the top and it's mumkin hai.
Sure, that's a good idea.
And another dimension for your critical thinking is Ministry of Education and Ministry of MHR has made mandatory for all the higher education institutions to establish institutional innovative cells for the past 2 years. As a result of that, many of the colleges across, more in technological colleges, engineering colleges, and a few medical colleges. I am proud that AVMC also has got a vibrant innovative cell, you know, and they have started monitoring that and monitoring they mandate the activities, give some small kind of encouragement, and the students, when they first invest, you will be astonished to see them, the innovations they make and all. We have to create opportunities for the students to do that.
Sure, absolutely, you're right. Yes, Ram, you have a question?
Sir, very nice talk. Sir, really enjoyed it. Actually, I was thinking how you would connect various diverse concepts, but you got it right very nicely. The only question I ask is, when you're trying to innovate, when you're trying to be creative, and it's something which is an uncharted territory, you're trying to see one vision which is only in your mind, and you want to communicate it to and get buy-in from people. That path is usually lined with a lot of problems.
Sure.
So what is the advice you are
we
giving?
do our routine work every day, try to take one small area and try to innovate there. Maybe, and I'm sure you will all, we try to do it at our own level, small way, like I'm sure Sir also has done so many things, small innovations. Some of them may be small, some of them may be big, but make an attempt. Be little more critical about yourself only. Take peers to criticize you. Every time you may not be successful, but I would to do it. I would ask my peers who are close friends to criticize first. They will probably give me the best answer. And if I fail, it's fail. Be ready for failure. Don't make it so emotional about it. But be safe in the walking, and I'm sure we'll be able to make many changes over. See, all your innovations don't succeed. They fail sometimes, but I mean, it's the way we really built ourselves. I think COVID was a classic example where pseudoscience was so high. Everybody took tons of HCG, tons of remdesivir, without realizing that it has a very limited value or no value at all. But I think that time people tried. But now over a period of time, it took many years, and we still don't know about, so these things do happen in medical science. So we have to make our students realize to critically evaluate every experiment, critically evaluate every publication. Don't just look at the abstract and say conclusion and accept it. Go through in detail. I think one of the tasks you should always do it, critically evaluate publication or a presentation. Don't accept everything. You are here to ask questions, not answer them. This should be the policy. This should be the first sentence in your lab when somebody enters your college. Be inquisitive.
Yeah, our convener of innovative cell is restless.
Oh, sure.
Said that innovation and all these things, entrepreneurship should be encouraged. But how to promote our students, how to motivate to think differently? The problem is that our NMC has given us timetable which is crowded timetable. We don't have any time separately kept for such things.
Sure.
So I think this issue should be addressed in NMC.
Sure. No. I think, question is we have given time for yoga, we have given time for kind of all this cricket and all, everything we tried to give.
This is my grievance, sir.
Yeah. So I'm sure, how it's not so easy to work in NMC. I first prepared a curriculum and then we said we will have, say, 25 hours for sports and 25 hours for, something like meditation and all, something like that. Next day, Times of India gave a big kind of an title. Medical students now will play with mat and bat. And then there was a pressure and they said, no, remove this and all. And then Modi ji came and Modi ji says, yoga is something. So it was introduced again. So I think there are so many other factors where which we work. But as you rightly said, many of our young students have talent. They would work out of the hours also for these kind of things where they feel self-fulfillment. They may take out time. Many times it can be faculty online or something like that. You need not be there, positively there. So if you want to run an innovative center, there has to be enthusiasm. There has to be out of kind of a box thinking, and people have to work beyond their day-to-day work if you're thinking innovative. Critical thinking should be part of your day-to-day teaching. Sure? Any more? Otherwise, I'm sure I'm available on email anytime, and you can always look at this talk.
Thank you,
Sure.
Avinash, for the take-home message, very clear.
Sure.
Change is ever changing.
Yes.
Be prepared for that.
Sure.
Excellent.
Sure.
Thank you very much.
Thank you. Thank you so much. Sure.
Thank you, Dr. Supe. That was an enlightening session. Now I request the chairperson of the session, Professor P.F. Kotur, Professor of Anesthesiology and Dean Arupade Video Medical College, to present a memento to the resource person.
The wonderful picture of the aerial view of Auroville.
Thank you, sir. Now I request Professor P.K. Sudhir, Vice Chancellor, VMRF, to present a memento to the chairperson of the session, Professor P.F. Kotur. Thank you, sir. Thank you, Professor P.F. Kotur, for chairing this scientific session. Before we move on to the lunch, I have a small announcement. I request all the participants of the award paper session to give you a PowerPoint at the May Help You desk. And I also invite our delegates to visit our stalls, virtual reality stalls by medicine, simulation stalls, and medimations, etc. are available. You can visit the stalls during this lunchtime. And lunch is served at the Legumes Hall, 4th floor. So I request all the delegates to join us for the lunch. We'll be having the post-lunch session at 1:40 p.m. I request everyone to join back for the scientific session post-lunch. Thank you.